Hello, everyone. I'm your host, Achima, and welcome to another episode of Let's Talk Psychiatry. So, today we are going to delve into another interesting topic. It's really important to talk about this. It's called anxiety disorders. Now, everyone at some point in their lifetime experiences anxiety. Well, it's a strong emotion, that everyone feels. It's unpleasant, and it sometimes is associated with autonomic symptoms like palpitations. That is when you feel your heart beat like it's coming out of your chest tightness. Sometimes you can have stomach or abdominal discomforts. You can have restlessness and perspiration, which is sweating. So, anxiety usually warns off an impending danger, so a person is able to prepare to deal with the threat that's coming. So it should be differentiated from a very similar emotion called fear. Now, people say fear, anxiety, fear, anxiety. Now, fear is response to a known threat that is external and is definite, while anxiety, on the other hand, is a response to an unknown threat that is internal and sometimes is vague. Now, these two are both emotions that alert us and give us signals of impending threats and doom. Now, anxiety disorder is one of the most common group of mental health disorders or illnesses that is seen. There are neurotransmitters that are seen in anxiety disorders, and these neurotransmitters are associated with this are norepinephrine, serotonin, and gamma aminobutyric acid, also known as GABA. Now, knowing these neurotransmitters usually help us with the pharmacological treatment selection, which we're going to talk about later. Now, there's several anxiety disorders, and I'm going to mention them. The first one we're going to talk about is panic disorder. We have number 2, agoraphobia. Number 3, specific phobia. Number 4, social phobia, also known as social anxiety disorder. Number 5, generalized anxiety disorder. Number 6, separation anxiety disorder. And number 7, we're going to talk about selective mutism. So we're going to talk about each and every one of them. We're going to try to understand them in their various ways. Now, the first one I'll talk about is panic disorder. Now, this is an acute attack of anxiety accompanied by feelings of impending doom. Now, the DSM 5 criteria defines panic disorder as recurrent, unexpected panic attacks. Now, what is a panic attack? Panic attack is a sudden rush of intense fear and apprehension that reaches a peak about within few minutes or sometimes hours, and is sometimes associated with 4 or more of the following symptoms that I'm gonna say out right now. Now, the symptoms include number 1, palpitations, pounding at your heart, or you feel your heart beating, or fast heart rate. Number 2, sweating. Number 3, shaking. Number 4, shortness of breath. Number 5, feeling of choking. Number 6, chest pain or discomfort. Number 7, nausea, abdominal distress. Number 8, dizziness, lightheadedness, or fainting. Number 9, chills of heat sensations. Number 10, paresthesia, that's numbness or tingling sensation. Number 11, derealization, that's feeling of unreality or depersonalization, being detached from oneself. And number 12, fear of losing control. And last but not least, fear of dying. So when you have 4 or more of these, at least you can say, oh, I have a panic attack. Now, one of these attacks should be followed by 1 month or more of one or both of the following I'm going to mention. Now, if there's a persistent concern about an additional attack, I'm going to have an attack, and the consequences like losing control or as if you're having a heart attack, and also if you have a significant change in behavior that is related to attack. For example, if you have a behavior designed to avoid maybe going to the mall or avoid attacks like exercise or unfamiliar situations. So once you have this for at least a month, you can say, I have panic disorder. And this disturbances is not attributable to any physiological effect of substances or drugs or any other medical condition, and is also not explained by any other mental health disorder. Now, women are 2 or 3 times more likely to be affected by men, definitely. It's most commonly seen in the younger population. So you see teenage girls having panic attacks, panic disorder. There's usually a comorbid condition associated with panic disorder. Now, to diagnose panic disorder, you have to establish if the person has a panic attack. The treatment of panic disorder is number one, pharmacology. We use benzodiazepines and we use SSRIs. So benzodiazepines like Xanax and SSRIs like Prozac. And also we have therapy, the CBT, including family therapy and group therapy. So we're gonna stop here. I wanna make these videos short so it's easy to watch and it's also easy to understand. So we're gonna take it step by step. Next time, we're going to look at some of the other types of anxiety disorder. So, if you have questions, please send them to Let's Talk Psychiatry at gmail.com. Let's Talk Psychiatry at gmail.com. We're going to talk about anxiety. Anxiety is real. If you or anyone you know is experiencing the symptoms I mentioned, please go see your doctor or go to the nearest emergency department, emergency room for help. All right? So, until next time, my name is Sochima. Let's remain stigma free. Let's be aware mental illness is real. And I'll see you next time in our next video. Bye for now.